Okay, so we're going to talk about reproductive anatomy. Or female reproductive anatomy. Try to get the thing big. Okay, so the reproductive organs for the female, the primary organs are the ovaries, while the accessory organs are the uterine tubes, the uterus, the vagina, the clitoris, and the mammary glands. So the primary are the ones that make the gametes, while the secondary are what's essential to reproduce. So to keep the fetus alive. Okay, so here is the anatomy, and we went over this in lab, so I'm not going to go over it again. Okay, so here's the ovary. So the ovary, there's usually two ovaries. They're oval. They're almost like almonds. So they're going to make the eggs, and they're going to make estrogen and progesterone. So they are covered with the thing called the tunica albuginea. The cortex produces the gametes, but in the part in the middle, the medulla, makes the follicles. Okay, so each egg develops in its own fluid-filled follicle, and then the eggs are released by ovulation. So they've described it as a water balloon. So the follicles are the little houses that hold the eggs, and the eggs develop inside of those, and the follicles get bigger and bigger, like if you were filling up a water balloon, and finally the water balloon bursts and the egg is released. Okay, there's a series of ligaments that hold the ovaries and the uterus in place. And we talked about those in lab as well. Here's the picture, so we talked about those. Okay, here's an ovary. We looked at this model in lab. Okay, so we're born with the primordial follicles. So primordial follicles develop into primary. Okay, and then it develops further into a secondary. Gradually, the egg is going to be pushed off to the side, and you're going to get this vesicle in here. So they're calling this one a vesicular follicle. It's almost a mature follicle. It's not quite. So it's filled with this fluid. This fluid, it has estrogen and progesterone in it. So gradually the egg is going to be released. Okay, and this tissue that's left just doesn't go away. Okay, it becomes the corpus luteum. The corpus luteum is going to release estrogen and progesterone, and that's going to regulate the menstrual cycle. Okay, and then eventually this is going to shrivel up and you get what's called a corpus albicans. Okay, so ovarian follicles, there's thousands in your ovaries, in the cortex of it. They contain oocytes, which are the eggs, and the follicle cells are going to support the eggs. So they're going to make sure the eggs have what they need to develop. Okay, so here's walking through it, the oogenesis and the ovarian cycle. So first thing you have is primordial follicles. That's what you're born with. Okay, they're stopped at prophase 1 in meiosis. Okay, and they have a single layer of cells on the outside. When females are born, they have 1.5 million at birth. Okay, and menopause is going to occur when we run out of the 1.5 million. Okay, the primary follicle contains a primary oocyte, and it starts to get a little more complex. They have one or more layers of follicle cells around them. Those cells are called granulosa cells. Okay, and they're going to make estrogen. There's also thecal cells in there, and they're going to influence hormone production as well. The big ones we're worried about are these granulosa cells. Okay, the secondary follicles have a primary oocyte as well. They have lots of layers of these granulosa cells, and they are starting to get this vesicle or this space inside of them, and that's called the antrum. The antrum's filled with serous fluid that has estrogen and progesterone in it, and the oocyte gradually gets forced off to the side of the follicle. Okay, the vesicular follicle is the last stage of follicles. Sometimes I call them mature, sometimes I call them Graafian. So it's really large. It has a secondary oocyte. The secondary oocyte is stopped in metaphase 2. Okay, so it doesn't finish metaphase 2. It doesn't finish meiosis unless it's fertilized. They have a large antrum. Usually you only have one a month that develops. Okay, then ovulation occurs. When ovulation occurs, the follicle ruptures and the oocyte is released. It's released because there is an increase in luteinizing hormone. Okay, so a surge in luteinizing hormone triggers ovulation. Okay, so then we have the corpus luteum. Okay, it secretes estrogen and progesterone. Okay, and that's going to control the uterine cycle. Okay, and then we have the corpus albicans. Okay, so here's this is a really cool picture. So here's the ovary, then here's the uterine tube. So they're not touching. There's a little bit of space, like an itsy bitsy teeny tiny space in between them. So the egg is released and it has to actually cross the empty space in order to get to the uterine tube. And these little fimbriae are the fingers, and they're going to kind of move and pull it in. Okay, now this walks you through the process that I just kind of laid out on the last slide. So this is just a summary page. It's a lot of information on one sheet. Okay, now here's the ovarian cycle. So the ovarian cycle, the way it's divided up. So we start, day 1 is the primary follicle, secondary follicle, vesicular follicle, ovulation is day 14. And then we get the corpus luteum, regression, and the corpus albicans. So the follicular phase is when the follicle is developing, and then the luteal phase is when the corpus luteum is developing. The luteal phase is preparing the uterus for fertilization. So if you have a zygote in there, it's getting the uterus ready for the zygote to have a place to implant. Okay, so here's what happens. So the luteinizing hormone surges about day 14, okay, and that's what's going to cause ovulation. Follicle stimulating hormone goes up too. Okay, now the ovarian hormones, what happens, okay, is that the estrogen goes up because the mature follicle is getting really, really big. Okay, so it's getting big. Okay, and then here's the progesterone from the corpus luteum. Okay, so it's prepared. The progesterone is making the walls of the uterus thicker. Okay, now if we look at this picture and we try to go through it. Okay, here's gonadotropin releasing hormone. Here's hypothalamus, gonadotropin releasing hormone goes down to the anterior pituitary. Okay, the anterior pituitary is going to release FSH and LH. Okay, so here's what's going to happen. So the ovarian follicles, as they're maturing, they secrete inhibin. Okay, so the inhibin goes back, and that's going to have negative feedback, so we don't keep making more eggs at one time. Okay, so we want to inhibit this. Okay, there's low levels of estrogen, okay, because the follicles don't have very much estrogen in them. So that also inhibits the production of FSH and LH. Okay, so estrogen levels are low, okay, and the follicle is going to start to develop. So as the follicle develops and you get this space in here, you're going to have an increase in luteinizing and follicles. You're going to have an increase in estrogen. Okay, this increase in estrogen is going to come up. It's going to tell the hypothalamus and the anterior pituitary to release luteinizing hormone. So once you hit a certain threshold of estrogen, you release luteinizing hormone, and the luteinizing hormone is going to cause the egg to be released. Okay, then the corpus luteum is going to start to form progesterone and estrogen and inhibin. Okay, and these are going to feed back again to the hypothalamus and the anterior pituitary. Okay, now the uterine tubes, so those are the fallopian tubes. Okay, so we talked about them. The infundibulum part is funnel-shaped. The fimbriae are the little fingers that are going to come over to the ovary to get the egg. The ampulla is kind of like the trumpet part, like a funnel part, too. The isthmus is narrow, and then the uterine part's going to attach to the uterus. The mucosa in there is simple ciliated columnar epithelium, which that makes sense if you think about the movement of the egg. Okay, and it also has muscularis. It has some muscle in there, muscle layer. The uterus we've talked about, so it's pear-shaped, it's muscular, so the whole idea behind having the uterus is to support, protect, and nourish the embryo. Okay, it's going to form a connection with the embryo, and that connection is going to develop into the placenta. Okay, the cervical canal connects to the vagina. We talked about all the muscles that are, or not the muscles, but we talked about the ligaments that keep the uterus in place. So the round ligaments, there's transverse cervical ligaments, there's uterosacral ligaments, and then the muscles of the pelvic floor are all going to keep the uterus where it's supposed to be so it doesn't prolapse. Okay, so I think we're okay with this. So here's the cervix. The cervix is the most inferior part of the uterus. Okay, that's where the opening is. Okay, now the uterine wall is made up of 3 layers. Everything's got 3 layers. So the perimetrium is the outside serosa. The myometrium is the thick wall of smooth muscle. And then the endometrium is made up of mucosa. So the mucosa is simple columnar, and it's got lamina propria tissue in there, and there's glands in there. The endometrium is broken down into 2 layers. One's called the basal layer, and one's called the functional layer. The basal layer stays in there. It's the permanent layer, while the functional layer is what's shed every month. Okay, so if you look at this, the myometrium, this is the wall of smooth muscle, and if you looked at it, it would be it's a lot thicker than that, but you can't see it all on this image. Okay, the basal layer is going to stay, it's going to remain, and this functional layer is going to get thicker and thicker all the way up until menstruation. What's going to happen is as the progesterone levels drop, the little arteries that are supplying the functional layer with blood are going to constrict. And when they constrict, the functional layer is going to die and it's going to slough off. Okay, I have to laugh because the dog is rolling around on the floor. I can hear her collar jingling. Okay, now here's the vagina. So 8 to 10 centimeter long, distendable muscular tube. Okay, here's the layers. It's tilted posteriorly. It's between the rectum and the urethra. Okay, now the menstrual cycle is also known as the uterine cycle. So it's just the changes in the endometrial lining. So it's under control of the hormones that are released by the corpus luteum. So 3 phases. So menstrual phase, proliferative phase, and then the secretory phase. Okay, so the menstrual phase starts at day 1, the first day of menstruation, and that's when the functional layer sloughs off. Okay, then the proliferative phase is the layer is going to get thicker. Okay, and then secretory is when the progesterone from the corpus luteum is stimulating the growth of the functional layer. Okay, now the vulva is considered pretty much like the external genitalia. So it includes the mons pubis, which is the layer of fat over top the pubic symphysis, the labia majora, the labia minora, okay, and the labia minora has where the openings are. The labia majora, I always think of it has hair on it, and the minora doesn't. The clitoris. Then we have the vestibular bulbs, and then there's some more glands in there that are important for lubrication. They're going to release mucus. Okay, so here's the mons pubis. The mons pubis. Okay, there's, I don't know, you guys are okay. And then here's the picture where you can see the bulbs and the clitoris. Okay, and then the breasts. Okay, so the breasts lay on top of the pectoralis major. Okay, they have the nipple. It's surrounded by the areola. They have suspensory ligaments in there, and the suspensory ligaments are going to hold everything together. If the breast is not lactating, they don't have many mammary glands. They're smaller, so it's just a lot of ducts and fat tissue. Okay, so here's the suspensory ligaments that are kind of holding everything together. Okay, and then menopause and climacteric. So climacteric is kind of the male menopause. So menopause and climacteric is what happens when the hormones stop, or hormone production slows down as you get older. So they say the average age of menopause is 52. Okay, so what happens is we are running out of follicles. Okay, so we're running out of primordial follicles. So you have less secretion of estrogen and progesterone. So the uterus, vagina, and the breast get smaller. The skin becomes thinner. Bone mass declines. Okay, you could cause osteoporosis. The estrogen helps maintain bone mass. There's a risk of increase of cardiovascular disease. It also triggers hot flashes, which can, because of the drop in hormones, the change in hormones, that the cutaneous arteries dilate, they get big, and so then you get hot and flushed. Okay, one of the things that they do is they use hormone replacement therapy, so HRT. It's a low-dose estrogen and progesterone, and it can kind of counteract these side effects. But that's one of these things that you have to talk to your doctor, and you have to figure out your risk factors and things like that. So it's not for everybody. That's it.